Hello everybody, I'm Dr. Vahini Reddy and I have my private practice called the Dental Venue in Koramangala, Bangalore, India. Patients on occasion come to me asking me about root canal treatments. Now, root canal treated teeth are expected to last several years if not a lifetime. However, on occasion, these root canal treated teeth do become symptomatic, showing symptoms of pain, tenderness, or sometimes even pus oozing out of the gums adjacent to it. Under such circumstances, an additional procedure might need to be undertaken called an endodontic retreatment procedure. There are many reasons as to why this could happen. Sometimes your teeth may have an additional canal that may have been missed out during the initial process. It may not have been located and bacteria proliferate in this canal, causing the tooth to become symptomatic. Sometimes a new cavity develops on the tooth and causing symptoms. It could also happen due to sustained infection if the canals were not sterilized properly the first time round. Underfilled root spaces and improper instrumentation also contribute to symptoms of a failed root canal. Now, retreatments are often complex and require the intervention of a root canal specialist called an endodontist. It is important that you attempt this process because we know that nothing looks or feels as good as your own natural tooth.